Hi, welcome back to our channel and thanks for joining us today when we're going to cover the subject of breast reduction. Now, Valerie, what are the reasons why a woman might want to have a breast reduction?
I would say that in my office, I actually see women who are seeking breast reduction daily, and probably several women every day. And most of the time, they will complain of having large and heavy breasts. The main symptoms they will describe include neck pain, shoulder pain, back pain, shoulder grooving at the bra straps, and also sometimes rash under the breast, sometimes more in the summer months or not, or all year.
Okay. Can you talk us through what happens at that first consultation when they see you?
Yes. So during the first consultation, I talk to my patients because I want to get to know them. And so we'll talk about their past medical history. Do they have active medical conditions that are important for me to know about in planning their surgery? I want to know about the medications they take. Is there a family history of breast cancer, for example? Things like that. I also really want to know about any prior breast surgery that may impact the planning of the breast reduction. In addition, I want to know when was their last mammogram, if they are over 40 years of age, and I want to, of course, see the results of the mammogram. If they haven't yet had their mammogram, we try to plan it also before surgery, because I think the last thing that women would want is to have their breast squeezed after a breast surgery. Right?
Yeah. And we kind of want to make sure that nothing else
of course
is happening in the breast before a breast reduction.
Absolutely.
Yeah.
So I'm also interested to know what they do for a living, because it will impact their recovery. And most importantly, and this is a recurring theme, I want to know if they're smokers.
Yeah. Smoking
is really important to know, especially in terms of planning an elective surgery like a breast reduction. And, I think breasts are such an important part of the female identity. I think that if you're planning to have an elective breast surgery, you want to set yourself up for success. And that, in my mind, includes definitely stopping smoking prior to surgery.
What happens afterwards?
So after I've gathered all the information I want to know about my patients, then I'll move on to the physical exam. So in the physical exam, of course, I will assess their breasts. I will, assess the shape, assess the size. I want to assess the skin quality also, because if they have, for example, a lot of stretch marks on their breast, it may impact the final outcome, and it's important to discuss it with them. I want to also look at the position of the nipple on the breast, and palpate the breast also to make sure that there are no lumps or masses that the patient may or may not have identified themselves. And then I take detailed measurements during the physical exam, because this will really help me to plan a meticulous surgery.
Now, you've done all of that. Can you take us through the next step, which is the surgical procedure?
Yes. So once we've done the first consultation and the patient is approved by her health insurance for a breast reduction, then we move on to surgery. So in my practice, breast reduction is done as an outpatient. It's of course done, the surgery is done under general anesthesia. And so there are several different incision patterns that can be done on the skin, and these vary depending on breast size and the amount of reduction we're planning on doing. So the goal really of the operation is, of course, to make the breast smaller. And how do we do this is by removing some of the breast tissue, but also some of the overlying skin so that there isn't any excess skin hanging after the operation. And so in order to get the best breast shape possible, what we want to do is remove some of the skin, remove some of the breast tissue, and then also lift the position of the nipple so that the breast is smaller, lifted, and cosmetically pleasing.
And I imagine it's a surgery that women are very happy about afterwards. Right?
Yes. It's important to say that breast reduction is probably, in my practice and the operation that I do, that patients are the most satisfied about. And the main reason for this is that the relief of the neck, shoulder, and back pain is almost instant after surgery. When I go see patients a few hours after their surgery or when they come back for their first post-operative visit, they rarely talk about the pain from the operation itself, which is present, but they will most often spontaneously talk about how great they feel from having the smaller breasts.
Okay. Despite the fact that they're quite happy afterwards, it's still a surgery that has its potential complications, right?
Of course,
Yeah.
of course.
Do you want to go over those?
Mm-hmm. So, well, first thing I will say is that overall breast reduction is a safe operation. But like anything in surgery, there are possible complications. The two complications that probably apply to any surgical procedure is infection and bleeding. I would say that in my practice, these two complications are pretty rare. For breast reduction, I would say probably less than 1%. Other possible complications with breast reduction surgery will include loss of sensation to the nipple, which can be either temporary or permanent. There can be some wound breakdown. There can be some breast asymmetry or unevenness after surgery, although we always try to make the breast as even as possible, of course. There can be also what we call fat necrosis, which essentially means that there is some fat that dies from receiving poor or not insufficient blood flow. And patients will identify this because it feels like a hard lump in the breast. So I would say these are probably the most common complications. And then there is also I would say in very large breasts where we do a very big breast reduction, there can also be a risk of loss of the nipple as well.
And can anyone at any age request a breast reduction? For example, let's in particular like the category of teenagers. Can they have a breast reduction?
Yes, definitely. And actually that's probably a big part of my practice as well. I really enjoy working with teenagers, and I often meet teenagers who are looking to have a breast reduction. Most often when they show up in my office, they describe how self-conscious they are about their large breasts. And they also feel a bit outcast in school because they're not necessarily able to participate in sports, or they find that they're limited in the sports activities that they can do because of their large breasts. Teenagers are contemplating having a breast reduction. It's important to let them know that if they become pregnant at some point, their breasts will enlarge again and may not go back to their pre-pregnancy size, or for example if they gain weight. And so that means that if they have a breast reduction as a teenager, there may be a time at another time in their life where they may require another breast reduction, and then having two breast reductions definitely is associated with more risk and complication.
Okay. And probably one of the things that women worry a lot about when they have extensive breast surgery is, can they breastfeed afterwards?
So this is a discussion I'll definitely have with, most importantly, with teenagers when they're considering having a breast reduction, because this might not necessarily be something that they have thought about, you know. So during the consultation with teenagers, or also with women who are thinking of having children, you know, even in their 20s or beyond, I think it's important to let them know that the answer to the breastfeeding question is most likely yes, they can breastfeed after a breast reduction. But I think one thing that's also important to discuss with them is that it's not a question that has been clearly answered by scientific studies. And the main reason for this is that the ideal study design for to answer the question about breastfeeding is that we would want to have a female who has had a child, has breastfed, then has the breast reduction, and then has another child that she is breastfeeding. And that's a pretty unlikely scenario in real life. So, you know, I think that's what I always explain to my patients. And the other thing is that there are studies that actually did look at this question and studied this question. But what we see in the studies is that, they were done several years ago, and the plastic surgeons would actually tell their patients to not even try breastfeeding. And so if the women would answer a survey question saying, you know, are you able to breastfeed after breast reduction? And they would just say no, when in fact they have never even tried, and maybe they would have been able to breastfeed.
Yeah.
So I think overall, if we look at this from a theoretical perspective, yes, we make the breast smaller, so we do cut out some breast tissue, but there is breast tissue remaining after breast reduction. And so therefore, I think that the breast should be able to produce milk. And also because in the breast reduction surgery, the nipple is not detached from the breast, then technically also, I think women should be able to breastfeed.
Okay, so I hope that if you were looking for information regarding breast reduction, we've answered some of your questions today. If you do have more questions, please leave them in the comment section below and we'll try to answer them. Thanks for joining us today, and we hope to see you next week for our next video. Thank you. Le microphone est on?